My name is Patrick McKeown, and since 2002 I've been teaching functional breathing exercises to both children and adults. I came across this area as a result of my own breathing problems. I was a kid growing up with asthma, I had chronically stuffy nose, I was constantly mouth breathing. It impacted my lungs, my asthma was getting progressively worse, I was on medication all the time of course, my sleep was really disturbed, my academic ability was reduced. So for me to get grades, which I did get and got a master's degree from Trinity College Dublin, but I had to work so hard. I came across the importance of nasal breathing when I was 26 years of age. I want all children, regardless of age, to have access to the same information that I found out when I was 26 years of age. And it's for this reason that we were putting these exercises out free on the internet. No child should persistently breathe through an open mouth. It's not harmless. It's not this seemingly, innocuous thing. Mouth breathing is probably one of the worst habits that any child can develop. We know from studied children that between 25 to 50% of studied children are persistently breathing through an open mouth, both during wakefulness and during sleep. No child reaches their full genetic potential if they are using their mouth to breathe. Why? Number one, mouth breathing, in simple terms, is not conditioning air before it's drawn into the lungs. Number two, mouth breathing reduces oxygen uptake, the pressure of oxygen in the blood. Number three, mouth breathing can disturb breathing patterns, causing a lowering of carbon dioxide, resulting in blood vessels constricting and reduced oxygen delivery throughout the body, including the brain. Number four, mouth breathing. When a child is growing, it's important that their mouth is closed with tongue resting in the roof of the mouth to guide the forward direction of the jaws. We need the tongue resting in the roof of the mouth as it's the pressures exerted by the tongue which helps to shape the maxilla. So we want a wide and U-shaped top jaw with a good airway. And that's why mouth breathing is not ideal, because mouth breathing will result in the jaws set back in the face, the airway more narrow, the teeth overcrowding with a high narrow palate and an infringed nasal cavity. And what's more, mouth breathing during childhood, the effects of it carry throughout the child's life, in terms of sleep, in terms of forward head posture, in terms of the lungs. So the child's cognitive ability, child's exercise ability, child's sleep, child's craniofacial development is all impacted by mouth breathing. There is no reason why a child needs to breathe through the mouth. If it's a habit, we can address that. And if it's an obstruction of the nose, if it's rhinitis, we can address it. If it's enlarged adenoids, well then it's likely that the airway can be compromised as well. This is where a functional dentist or a dentist who is trained in terms of development of the jaws can help the child, because enlarged adenoids are a problem when the airway is small. The gold standard of treatment for sleep apnea with children is generally tonsillectomy and adenoidectomy. So even though children were undergoing adenoidectomy and tonsillectomy for several decades, the efficacy of it was investigated in 2010. The conclusion reached was, in a study of 587 children, that residual sleep apnea continued in about 73% of them. 27% were completely cured. Now the AHI did drop significantly, but at the same time, 73% of children persisted with obstructive sleep apnea post-tonsillectomy and adenoidectomy. Another statistic, and this was taken from one of Dr. Christian Guilleminot's paper, unless nasal breathing is restored, the AHI, which is the apnea-hypopnea index, shows a worsening. There's a 65% relapse within 3 years post-tonsillectomy and adenoidectomy unless nasal breathing is restored. Nasal breathing is the key to a child's development. We need schools learning about this. We need school teachers learning about this. Why allow a child to underperform, to not reach their potential, simply because they have a habit which we as healthcare professionals have failed to address?